This workout, we're going to start with hand and knee position. Go into the hands and knees position and put your knees as wide as you can and go into the child pose. As you go into the child pose, take your fingers and step forward, stretching your back at the max. Start breathing with an exhale from your pelvic floor all the way up through slightly open lips and inhale into the nose. Exhale, nice and smooth. Inhale into your pelvic floor, stretching out those muscles. Exhale and inhale. And one more time. Exhale and inhale. On the next exhale, lift yourself up back into the hand and knees position. Bring your knees back to the pelvis width and push your pelvis back. We're going to do some more breath. Exhale through slightly open lips. Inhale into your pelvic floor, letting your abdominal go down. Exhale, the abdominal goes in a little bit. Inhale into the pelvic floor, stretching those muscles. Exhale and inhale. Again, exhale and inhale through your nose. From here, exhale and inhale. Nice, smooth exhale through slightly open lips. Inhale. Light exhale, nice and long, getting your abdominal go in. And inhale. One more exhale. And inhale. From here, go back into the modified child pose where we put one leg to the side, foot looking forward, and pushing ourselves back into the child pose. This is a hip flexor opening that is going to help you to get the sciatica nerve pain away. Stay in this position. Inhale into your abdominal and pelvic floor. Breathe. Do not hold your breath. You might feel some tightening, and we go up on exhale. Bring your knee back. And let's do the same thing to the other side. Make sure that your foot is looking forward. Your toes are looking forward. You are opening the side of your thigh, the side of your pelvis, letting all those ligaments open and letting all those muscles open. No holding breath again. We are holding it for about 20 seconds. And on exhale, we go back into the hands and knee position. From here, lift one foot up and start looking at it from both sides, turning both your pelvis and your head. This is a pelvic rotation exercise that is supposed to help with the mobility of your pelvis and ease the low back pain that comes with a sciatica nerve pain. The free breathing here, you don't have to focus on inhale and exhale. If it's easier for you, you can focus on which side you inhale and which side you exhale. And put the leg down and do the same to the other side. First looking from one side and then from another. You can imagine that this foot that you have there is your tiny tail like a cat. You're trying to chase it from one side and from another. One side and another. And again, one side and another. You can see that the whole back is moving here. One side and another. And again, one side and another. And put your foot down. Make your knees wide again and go back into the child pose. Again, step forward a little bit and bring one wrist over the other. And do it to the other side, stretching your side muscles and stretching your back. Side on the side. Again, the wrist over the other one. Make sure not to touch the floor with the top hand. And to the other side. Hold it. Bring it back to the center. Lift yourself up on exhale. Push your pelvis back a little bit and bring one leg up and go into the pigeon pose. When you go into the pigeon pose, make sure to keep your head up and make sure that you put your weight on your arms here. Breathing into your abdominal and your pelvic floor again. You might feel tightening in the front of the thigh, in your adductor here when you try to open it, and that is supposed to help you to get the sciatica nerve pain away. Hold it, slightly move up, bring the other leg to the front, switch legs. Make sure to try to bring your pelvis down as much as you can. Here we are focusing on keeping the neutral spine with a natural low back curve. So if you have a big belly already, being pregnant, make sure you find that comfort position where your belly is not having pressure from your lower foot, from your front foot. Hold it for a little bit more. And again, bring the other foot to the front. And I'm gonna turn face to you, bring your feet down, and we're gonna do the round angel pose. Here the main point is to keep your feet together. You can use your elbows to press your knees out. If you feel like you need extra support, you can also sit by the wall to keep your back straight. Make sure you sit on your seat bones and you breathe. Breathe into the abdominal, in and out. Into your pelvic floor, sitting on your seat bones. Hold it, opening your hips. Hold it a little bit more, and sit cross-legged. We're going to finish with breath. Inhale into your abdominal and pelvic floor. Exhale, letting everything go in. Inhale, exhale. Exhale through slightly open lips. Inhale through your nose. Inhale and exhale. Again, inhale and exhale. And one more. Inhale and exhale. Inhale and exhale. We are slowing down here and working our pelvic floor. And we are all done. Thank you for watching.